Talking ketamine today because it was recently approved by the FDA as a legitimate treatment for depression.
That is exactly what happened. Janssen Pharmaceuticals, which is a division of Johnson & Johnson, patented one of the enantiomers of ketamine. So every molecule can exist in a left form or a right form. You can have the same string of amino acids and they build the same structure, but they're mirror forms of each other. So molecules exist typically in what's called a racemic mixture. They have both the left and the right in the mixture. And that's what ketamine is. It's a racemic mixture. But you can't make money off of a drug that is in the mix and has never been patented. So what pharmaceutical companies have done is that they've taken one of the enantiomers, either because they think it is the active one or because it's as active as the mixture, but more importantly, it's patentable and thus make moneyable about. They can make money off of it. That's what Janssen did. I think they made the left enantiomer of ketamine. It's a dissociative anesthetic that is used very commonly for very short acting procedures. It's used in veterinary care all the time, a lot of human use, and particularly in pediatrics. It is not a hallucinogenic drug in the realm of, say, LSD. It is a drug that dissociates the self from the outside. I think of it as something that creates a state where you're so dissociated from the reality that the reality almost appears to be an hallucination. People can be disturbed by it, and they are marketing it. It's esketamine. Actually, I'm not sure what's the name of the drug that they're marketing. It's not esketamine. Anyway, the drug name is esketamine. They are putting it out there as a nasal spray. That's what their patent is for, as a nasal spray. Now, here's the context. Since the 60s, we've known that ketamine, the racemic mixture, can alleviate depression and other mood disorders in a matter of hours to a day, rather than the 3 weeks that it takes for, say, tricyclics or lithium or SSRIs, any of those other what are now standard treatments for depression, what it takes for them to actually work. So this works acutely. So the bottom line is there are clinics throughout the United States where for a few $100 you can get an IV injection of the racemic mixture of ketamine out of pocket. But alternatively, now with this announcement from the FDA, you can have your insurance company pay thousands of bucks to get you officially blessed, shall we say, nasal spray esketamine. There's no evidence that taking one of the enantiomers out of the racemic mixture makes it any difference.
So what do we know about the actual neurobiology of ketamine? How it affects the brain, what parts of the brain it affects, what processes it interrupts?
We know a lot about it at a micro level. It is an antagonist at the NMDA receptor.
Ah, okay.
Now, do you remember the NMDA receptor?
I read the book, Brain on Fire.
That is such a great example.
Yes, that's a great book.
This is the story of Susannah Cahalan, her personal story with this tragic condition. It's a disease where there are antibodies that are going to attack the NMDA receptor. The NMDA receptor is a very important receptor. It is one of the 2 ionotropic receptors for glutamate. Let's unpack that. So an ionotropic receptor is a protein complex that sits in the membrane, and when it binds the neurotransmitter that's interested, in this case glutamate, it actually opens up. Okay, so it can make a pore. It makes a pore, and through the pore goes the ions.
Right.
When it binds, it opens, pore is open. The trick about the NMDA receptor is that when it opens, it doesn't open because There's sitting in the pore is a magnesium ion, and it won't allow ions to flow because the magnesium ion is a big honking ion with a water around it, and it's blocking the pore. And it's sitting sort of towards the outside of the pore. So what has to happen is that the cell has to depolarize. It has to have its voltage become more positive to shove out the magnesium ion. So that you basically have to have two things. Mr. Cell has to be excited, plus you have to have glutamate on binding.
And glutamate is another neurotransmitter, the sparky cousin.
Glutamate is the most common excitatory neurotransmitter. And so because you have to have two things happen at the same time, the NMDA receptor is what we would call a coincidence detector. Neither of those two things will open up the NMDA receptor. They both have to happen at the same time. Okay, what does that mean? Where do we take a coincidence and make it that's the thing? That's called learning. Every time I hear the bell, I get food. I want to make those two one and the same in my brain. So I detect the coincidence. To detect the coincidence, I use the NMDA receptor. So the NMDA receptor is absolutely critical to the cellular mechanism of learning, regardless of where you are in the brain.
And what does ketamine do for that?
It blocks the NMDA receptor.
Temporarily.
Yeah, temporarily, but effectively. I think that, you're so right to bring up Brain on Fire. That shows you if you don't have your NMDA receptors working well in your brain, that's how well you function, which is to say not. Even though she's an incredibly capable, interesting, accomplished woman, she couldn't do it without her NMDA receptors. No can do. One of the things that struck me was she got on this whole thing about being that she was sure that her apartment was infested. And even though there was evidence after evidence that it was not infested, she could not learn from that evidence. You can't learn without the NMDA receptor, but also because the NMDA receptor is everywhere, it affected all manner of her functions.
So let's wrap up on ketamine.
Yeah.
It has had a storied and convoluted history. Had really wonderful clinical uses, really scary recreational uses, and now it has a brand new life because of the intersection of regulation and commerce.
But I think that we talked about all sorts of stuff that's ancillary to the primary point about ketamine, not about Janssen Pharmaceuticals' version of ketamine, but about ketamine itself, which is that it is a great possibility for people with intractable depression. These are people that have faced depression and they've tried all the various drugs. And let's say that the next stop is electroconvulsive therapy, which is proven to be effective for depression, but which is a scary thing because it has many, many side effects. And in contrast to going that route, which is probably going to be effective, but also probably going to be problematic, one can go down the route, the sort of no-cost route of trying ketamine. And I mean, I don't mean no cost in money terms, but no cost to the self going forward. You try it, and if it works, fabulous. You've avoided this very invasive, very problematic problem, and you've alleviated the suffering that comes with depression. There's a huge tool in the arsenal against depression. And so, yes, let's use ketamine. Let's use ketamine certainly before we use things such as ECT.
So you and the FDA are on the same page.
Well, I don't know if I would go that far. I'm not actually on the same page as all the ketamine clinics that exist already.
Well, but in terms of recognizing ketamine's efficacy in effectiveness in treating depression, you
But
approved
FDA didn't recognize that. It wasn't asked to recognize that. It recognized the effectiveness of esketamine.
all the articles I've read. They've said ketamine now approved for depression,
Yeah, but
but that's not.
it is not the IV racemic mixture which has been in use. They didn't say yes, go go go. That's good. They weren't asked to. They weren't given the data to evaluate that. It wasn't their job. They were given the data by Janssen Pharmaceuticals to evaluate the nasal spray of S-ketamine.
Okay. So that it's not that they broke any brilliant clinical new ground, but that Janssen Pharmaceuticals found a way to remonetize a drug that has been around for a while, and they found a way to rejigger it such that it becomes it has a new profitable life.
I think that's exactly right.
Well, okay, but still, in all, I mean, it makes it a little. Some people will benefit from it, in addition to
Definitely.
the stockholders.
And the publicity is, I think that you're right in what you said before, is that the soundbite is going to be heard as ketamine's now approved.
Right, for depression.
For depression. And so that is going to open up the world to people who may have thought that this was a very fringe approach.
Right. Okay.
And may look at it differently because it's now less fringe. They may look at it as though it's less fringe now because the FDA in this soundbite has apparently blessed it.
And there are worse things than that.
There are worse things than that.
That's what that'll do it.